Good afternoon, everyone, and welcome to all of you. Thank you so much for making the time to join our 2024 National Donate Life Month webinar. My name is Lauren Darensberg, Branch Chief of the Operations and Donation Education Branch and Lead Public Health Analyst in the Health Systems Bureau, which sits within the Division of Transplantation at the Health Resources and Services Administration, or HRSA. Today, I have the honor of moderating today's session. This webinar is being recorded. We'll share the link to the recording as well as the slides with everyone following the session. Please feel free to place your questions in the Q&A pod during the meeting. And lastly, at the end of the session, we'll share an evaluation survey. We appreciate your input. Today's webinar will begin with opening remarks from Dr. Suma Nair, the Associate Administrator of the Health Systems Bureau at HRSA. Then Dan Napoleon, a kidney transplant recipient, and Molly Gray, a living kidney donor, will share their inspiring journey with us. Next, we'll hold a panel session to highlight strategies for improving donation awareness and increasing donor registrations in your communities and workplaces. Then Nancy Rios, the Region 7 Administrator of HRSA's Office of Intergovernmental and External Affairs, will share closing remarks. Now, I'm going to turn it over to Dr. Nair for opening remarks.
Great. Thank you, Lauren. Good afternoon, everyone. I'm so pleased to welcome you all to today's webinar in honor of National Donate Life Month, a time when we come together to highlight the incredible gift of organ donation and the life-saving impact of transplantation. This month, we celebrate the generosity of donors and donor families. We recognize the work of all of the healthcare and other professionals who collaborate to honor the gift and spread awareness about the critical need for organ, eye, and tissue donations. I'd like to welcome and extend my sincere appreciation to our speakers, the event organizers, and everyone joining us today. Your presence signifies a shared commitment to saving and enhancing lives through organ donation. A special welcome to both Dan Napoleon, a kidney transplant recipient, and Molly Gray, a living kidney donor. As Lauren mentioned, they'll be sharing their inspiring testimonials. Dan and Molly, your courage and generosity embody the very essence of what we are aiming to promote and support during Donate Life Month, but in all actuality, every day. Today's panel discussion, after we hear from Molly and Dan, we'll be able to explore key donation outreach programs from the National Kidney Foundation, Donate Life America, and the Pikeville YMCA. It's through sharing knowledge, experiences, and best practices that we can really overcome challenges and truly harness opportunities to advance our cause. Thank you, Morgan, Clifton, and Hillary, for joining us today. As a part of HRSA's ongoing mission to save and enhance lives through organ donation and transplantation, I'd like to take a moment to highlight a cornerstone of our efforts, the Organ Procurement and Transplantation Network Modernization Initiative. This transformative effort is not just about improving systems, it's about creating more and more success stories, much like the ones we're honored to hear today from both Dan and Molly. The OPTN Modernization Initiative is at the heart of transforming the landscape of organ donation and transplantation by collaborating with key stakeholders across the organ transplant ecosystem, strengthening governance and accountability, innovating systems, enhancing efficiency, and fostering equitable organ allocation. We're not only modernizing the OPTN, we're redefining the future of organ donation and transplantation. Through strategic initiatives, rigorous research, policy development, and a relentless focus on patient safety and outcomes, we're committed to achieving these objectives and embodying the true spirit of National Donate Life Month. I'm excited for today's collaborative webinar. It's even a collaboration between the HRSA family, ourselves here in the Health Systems Bureau, in concert with our colleagues in HRSA's Office of Intergovernmental Affairs and External Affairs. This partnership exemplifies the power of collective efforts in expanding outreach, improving donation and transplantation awareness, and ultimately saving more lives. Together, we're making great strides towards a future where everyone in need of transplant is able to receive the gift of life. So in closing, let's remember that behind every statistic is a story, a life that has been touched by the generosity of a donor. It's these stories that drive us to continue to strive for excellence in organ donation and transplantation. As we proceed with today's webinar, I encourage all of you to engage, inquire, and participate actively. Together, we can make a difference. Together, we can save lives. Thank you for being here, and I look forward to a productive and inspiring session. Thank you.
Thank you, Dr. Nair. Now, let's continue our discussion with a video that captures the profound journey between Dan and Molly. This story not only highlights the transformative impact of organ donation, but also the deep human connections it fosters. Please watch as their inspiring story unfolds.
I was diagnosed with uncontrolled hypertension and type 2 diabetes. And that's kind of the perfect storm for kidney failure. When I found out I needed a new kidney, how did I feel? Scared. I was on the transplant waiting list just under 5 years. I met a number of medical personnel, and it was one of those individuals who kind of said, hey, why don't you have a donor? And I didn't have an answer. And the response was, because you don't know how to ask. And I said, you're 100% right. I was able to write an appeal letter, and I decided to put it out on social media. Dear friends and family, some of you may know, and many of you do not know, that a few years ago I was diagnosed with chronic kidney disease. And over time, my kidney disease has gotten worse, causing my kidneys not to work well enough to keep me alive. I am humbly asking a family member or friend to consider donating a kidney to me. I know this is a difficult decision. Imagine how difficult it is to have to ask.
I could not believe when I saw his post. I never knew that Dan was suffering from kidney failure. I had met Dan through our boys. So my son Cooper and his son Brandon happened to be on the same travel soccer team. I can't imagine his boys not being with their dad to a ripe old age. And so I decided right then and there, I'm just gonna throw my hat in the ring and see if I'm a match.
My transplant coordinator reached out and said, Dan, we have someone. When I found out that Molly was the individual, it was literally at a parent soccer meeting. And Molly comes up and says, hey, I'm going through the process. Things look really good. And I looked at her and I said, it's you. You know, I had no idea.
The first thing I was told was that I was not a compatible blood type for Dan. And I had a wave of disappointment until Dan said to me, wait, don't panic. We can do something different called kidney paired donation. I had never heard of this before. It's a pretty interesting process where basically two incompatible pairs, myself and Dan, we match with another incompatible pair. So my kidney goes to someone in that pair, and then the donor's kidney goes to Dan. So there's basically two people receiving a brand new kidney. And the cool thing is with paired donation, they can get chains up to 8, 12, 16. So it's awesome.
It was after soccer practice, and Molly comes up to me and hands me a gift bag. And inside of the gift bag was a little box, and inside the box was a kidney bean.
And he opened it looking very perplexed. And then he opened the box and he said, wait, what?
And she looked and she said, I can donate. I'm donating a kidney.
And he said, I can't even believe it. And it was fabulous.
I really didn't think it was real. You know, I really didn't think it was real. It's a life-changing experience, and I'm forever grateful. I don't know where I would be had I not received my kidney.
After I donated my kidney, I got really emotional the first time I saw Dan with his family. And that might have been when it hit me for the first time that in my mind, It was a small task, and I think for Dan and his family, it meant a lot more. You need to put yourself in the person's position who is waiting for that living donation.
I've had friends who didn't receive a kidney, and they're no longer with us. So my advice is to get the word out. I have a responsibility to do so. So this is Molly, who I've renamed my angel, who donated a kidney on my behalf. It was such a selfless act, and Molly has blessed me, my family, and because of her actions, I'm here today. So thank you.
You're very welcome.
What a touching story. We are now joined by Dan and Molly, the courageous individuals you've just seen in the video, whose actions have illuminated the path of hope and generosity. Let's delve deeper into their experiences. Dan,
Yes.
we've heard about some of your personal journey with organ donation and receiving a kidney transplant from your angel, Molly. Can you share more about how your journey has positively impacted your life?
Sure. When you're going through, as you say, the journey, when you're on dialysis, all kinds of things go through your mind. And a lot of it is sometimes negative. Following the transplant, I have a better appreciation for the little things. For example, my kids are very active with sports. I mean, that's actually how I met Molly, as you heard in the video. And I look forward to going to their practices and their games. I was only able to do that on the weekends. And now, even though I'm traveling sometimes an hour, it's still fun just to be with the kids during the week and not on dialysis.
Well, thank you. And Molly, it's truly admirable how you stepped up to see if you could be a match for Dan. How has your decision to donate impacted your life?
Thanks, Lauren. It's funny when you see the video again, I definitely get a little emotional and I get brought back to that time. I really just honestly get such joy knowing that Dan can spend so much healthy quality time with his wife and his boys. I mean, what I got out of giving my kidney, I think is just as much as what Dan got from receiving it. It's like his gift of life has returned. And I just feel so thankful that I was able to help my friend. It also really has made me just feel very, very grateful for my health. To know that I was healthy enough to be able to do this for another person, I feel very, very grateful.
Wow, it's just an incredible story. And to hear how you all met through your boys and sports, and now you're still continuing to enjoy that and have an opportunity to enjoy that together with your families. It's so beautiful. Did either of you experience any challenges or learn of any misconceptions or perceptions throughout the donation and transplantation process?
I think the misconception that I heard about first was when I was very excited to, throw my hat in the ring and try to donate. And then I was told right in the beginning that I was not a compatible blood type for Dan. And I was really disappointed, like I said in the video. And then Dan was the one who shared with me. And he's like, wait, Molly, no, that's like old school. We can now do it differently these days.
Yeah.
We have the shared kidney donation. And that was just the coolest thing ever because, we had a chain of 4 people. So 2 donors, 2 recipients, but there have been hospitals who have had chains of 8, 10, 12 people, which is just mind-boggling to me that they're able to do that. But that's pretty awesome. That was really the only stumbling block, and it was a stumbling block for a very, very short period of time, and then it was rectified. It was great.
Mhm.
Yeah, I don't think I don't look at it as a challenge, but you in order to receive the kidney, you have to be very meticulous and follow the rules and listen to your doctor and a lot of blood work and doctor visits, hospital visits, etc. But I just focused on the end result, so I didn't really look at that as a challenge, but some may find that to be tough. It does, it takes up a lot of time, but so does dialysis. So
Mm.
you got to weigh that out.
Yeah, absolutely.
Mhm.
I'm curious, have you all gotten involved in any advocacy efforts?
Yes. One of the things I initially did is I followed up with individuals that were on dialysis with me to kind of say, hey, this thing works. You have to be on a transplant list for more than one. Make sure they're listening to the doctors and following the plan and just showing, look, the end result is you don't have to sit here and, basically have a part-time job because you're there for 4 hours at a time for 3 times a week, and that's a part-time job you don't get paid for. So, you kind of remind them that this is something you don't have to do. I also, my fraternity, Kappa Alpha Psi fraternity, uh, the national fraternity, we have a health initiative. And since my transplant, we've added kidney function into our screening along with blood pressure and blood sugar and prostate issues, all of that, so, it's been great to kind of just raise awareness for that.
Very cool. Molly, any advocacy efforts on your behalf?
Well, the one thing I think that made it so easy for me to want to try to donate was that a neighbor and a good friend of mine had donated a number of years ago. So I remember hearing from her story, the process she went through, and how easy she recovered from surgery, and that helped me so much want to go ahead and give it a shot. So one of the best things I can do is just talk to as many people as possible and let them know it was not a big surgery. I mean, they do it laparoscopically. I missed some work, but really it is something that is very manageable. I was home from the hospital in 2 days, and I honestly, with the exception of a very small scar, I don't even realize that I am missing a kidney. Don't even miss it.
That is great. That's great to hear. Last question. Either of you have any advice for someone who may be considering becoming a living donor, Molly or Dan, someone in need of a transplant or their family members?
I think the best thing to do is speak with someone who has donated. They can take you through the A to Z process. And then I think speak to your doctor. Get all the facts, get your questions answered from your medical professional, but also speaking to someone who has been through the process, I think really helped. That certainly helped me, knowing what I was kind of up against and what things would happen.
I think, on the recipient side, don't be afraid to ask. Don't be afraid, because you would be surprised, as I was, at the generosity of people from so many walks of life. Truly amazing. There are definitely kind people out there.
Well, thank you again, both of you, for joining us, for sharing your story. And I know that this story will continue to inspire more people to consider living donation and get the transplant they need. So thank you again.
You're welcome.
Absolutely.
Now we're going to shift our focus to how we can broaden the impact of these life-changing stories. Our first panelist, Morgan Reed from the National Kidney Foundation, will discuss initiatives to enhance equity in transplantation. Morgan, please take it away.
Thank you so much, Lauren. Thank you to everyone at HRSA for allowing me the opportunity to speak to everyone on the call today. Molly and Dan, I will never tire of hearing your story. It is amazing. Good afternoon, everyone. My name is Morgan Reed. I always joke and say my name is Morgan, rhymes with Oregon, Oregon Morgan. You can't forget my name. But I am the Director of Transplant Policy and Strategy at the National Kidney Foundation. I am also a kidney recipient. My best friend in college donated her kidney to me 17 years ago after being on peritoneal dialysis for almost 2 years. So I'm very, very passionate about organ donation, transplantation, and again, very excited to speak to you all today. Next slide. So I would like to share with you all what the National Kidney Foundation is doing to make transplant a reality for those in need. In May of 2022, the National Kidney Foundation launched its Transplants for All initiative, which is co-led by myself and my colleague, Haley Jensen. She's the Director of Transplant Programs at the National Kidney Foundation. And we're really, really excited about this initiative. We're almost 2 years in, and our 3 primary goals for our Transplants for All initiative is to increase living donation, increase deceased donation, and advance equity in kidney transplantation. We want to make sure that no one dies while waiting for a kidney transplant, and we want to make sure that we have processes and policies in place so that anyone who needs a kidney has the ability to receive one. Next slide, please. And this is an organization-wide initiative at the National Kidney Foundation. Every area of our organization is focusing on Transplants for All, whether that is making changes through professional education, research, innovation, policy and advocacy, awareness, and patient and community programs. There are subject matter experts in each of these areas within the National Kidney Foundation. And again, we're focused on making transplant a reality for those in need. Next slide. So this isn't everything that we're doing to increase living donation, deceased donation, and equity in kidney transplantation, but I do want to share with you all some of the things that we are working on, again, to make transplant a reality. First, I'm going to start off by sharing a quote with you from one of our kidney patient advocates. Mr. Bullock says, "I donated to my husband 11 years ago, and he has had significant improvement in his health and well-being. I gained the satisfaction of having a positive impact on his life." Living donation for Mr. Bullock was a win-win. And I think we can agree that donating a kidney is a win-win for many people, just like we've heard from Molly and Dan. But here are a few ways that we're trying to improve and increase living donation. The Living Donor Protection Act, which is legislation to protect living donors from discrimination from disability and life insurance companies, has passed in 32 states. The National Kidney Foundation continues to work diligently to pass this on the federal level. We want to codify this into federal legislation, and also those who donate a kidney, we would love the opportunity for them to have FMLA as well as an additional protection. We use patient education programming to educate on living donation, the benefits. We have resources for those who are patients. We also have resources for those who are clinicians as well. And we're also partnering with DaVita to launch a patient navigator program. We want to make sure that anyone going through the transplant process, living donation process, isn't doing it alone, but has a navigator to help them through the process. Next slide. Here are a few ways that the National Kidney Foundation is increasing deceased donation. Mr. Blankenship, another one of our kidney patient advocates, shares, "Because of my transplant, I got to celebrate my son's 5th birthday." I don't know about you guys. I don't know how you feel about birthdays. I'm huge on birthdays. My birthday is May 3rd. I celebrate the entire month. The month of Morgan is what I call it. So when I saw this quote come through, it resonated with me. When you receive the gift of life, my gosh, let me just tell you, it is, I'm so grateful to celebrate every birthday here on this earth, thanks to my life-saving kidney transplant. So again, this quote absolutely resonated with me. But here are a few ways that we are trying to increase deceased donation at the National Kidney Foundation. Currently, we have a grant research project with a large academic institution where we're partnering with patients in dialysis centers to educate them on non-standard kidneys so that if they're ever offered one, they're more willing to accept it, right? Most patients, when they hear perfect kidney, that's what they want to hold out for, right? But we know that there are different types of kidneys out there that are just as life-saving as that perfect kidney that people think, that people, we want to make sure that everyone knows that there are different types of kidneys and all of them are just as life-saving. We're very supportive of the OPTN modernization initiative. We are so excited to partner with HRSA, whether that is through communications with Dr. Sumaner to bring the patient voice and the patient perspective to the OPTN modernization initiative. We are working diligently to make sure that Congress is giving HRSA all of the resources that the agency needs to have a successful modernization initiative. But we're very, very excited to support HRSA in this endeavor so that we have a best-in-class transplant system. We're very excited about this and looking forward to seeing this initiative through. And then at the National Kidney Foundation, we do have an innovation fund. So we are constantly thinking about innovation and technology, and we are investing in organizations and companies, startup companies that promise to improve organ preservation and organ viability. So we're very excited about this as well. We're also proponents for xenotransplantation and partnering with some of the companies in the xenotransplantation space as well. Again, to make sure that anyone that needs a kidney can get one, whether it is an allograft or a xenograft. So that's an area that we're focusing on as it relates to research, innovation, and technology as well. Next slide. And increasing equity in kidney transplantation is very important to us at the National Kidney Foundation. We want to make sure all, not some, but all people have the ability to receive a life-saving kidney transplant. So one of our advocates, Ms. Bensuda, shared this. I fully support removing the race variable from the EGFR calculations. As a Black patient who has collectively waited more than 14 years on the transplant list, the journey is daunting and hope is diminished. Time is life when waiting for a life-saving transplant, and losing time due to inequitable equations is unacceptable. So here are a few ways that the National Kidney Foundation is advancing equity in kidney transplantation. The National Kidney Foundation was, I would say, an instrumental part in removing race from the EGFR equation. We partnered with the American Society of Nephrology, ASN, to create a task force, again, to remove the race coefficient from the EGFR calculation. We are very excited that OPTN created a policy stating that all transplant centers have to use a race-free EGFR calculation. And we're very, very happy that Black patients that were affected by the race-based EGFR had their time restored through another policy that was implemented by the Organ Procurement and Transplantation Network, OPTN. So again, that's one significant step in the right direction to advance equity in kidney transplantation. In that same vein, removing race from kidney donor risk index is something that we championed. At the National Kidney Foundation, we linked arms again with ASN, the American Society of Nephrology, to work with the Minority Affairs Committee within OPTN, again, to advocate for the removal of the African American donor characteristic coefficient from kidney donor risk index. Again, another way to propel equity in kidney transplantation. And then the last thing here is pre-waitlist data collection. For the past year and a half, the National Kidney Foundation has been a strong advocate for collecting pre-waitlist data, and we couldn't be happier that HRSA has announced that as a part of the OPTN modernization initiative, that there is a directive to collect this data. We want to make sure that, again, everyone has access to transplantation, not just some people, but all people, regardless of their race, ethnicity, their gender. We want to make sure that there's equity in kidney transplant. So with this pre-waitlist data collection, we'll now be able to have some visibility into who's being referred for transplants, who's making it through the evaluation process, who isn't, so that we can start implementing interventions to mitigate any hurdles and barriers to transplant access. So again, very, very exciting time in transplant. There's so much happening. And, at the National Kidney Foundation, as the Director of Transplant Policy and Strategy, just making sure that NKF isn't just talking the talk, but that we're actually walking the walk, again, to make sure that people have access to transplant. Next slide. And so this is it. This is my last slide. Receiving a transplant literally means everything to me. Living on dialysis is very hard. Dialysis is surviving. Transplant is living. This is from one of our patient advocates, Mr. Halter. Again, just communicating the importance of transplant. And thank you so much to HRSA for allowing me to speak here today. Have a great day, everyone. Thank you. And I guess I'll toss it to Clifton. Awesome. Thank you.
Clifton, you might be on mute.
Can my co-host, please?
Can you hear me now?
Yes, we
Yes.
can.
Okay, sorry about that. I'm not very tech savvy. But yeah, so my name is Clifton Hatfield. I'm the executive director here for the Pikeville Area Family YMCA. And we've really done some outreach, particularly with Donate Life Kentucky. They've actually been a very big supporter of our programs, especially our youth sports programs. And what really got started is they recently approached our executive director about how they could kind of outreach and get the word out about Donate Life. And so our sports programs was a great opportunity because they did a year-round sponsorship with us, and it allowed us to get some jerseys and some equipment, some much needed equipment for our sports programs. And it allowed us to actually, kind of get their logo and the visual aspect out there. And we actually have, there's one of the shirts now, which a lot of the other shirts was a little bright colored. That was our goal, is we want to kind of get it out there. And of course, they also did a sign in our gym, which you can see up in the upper left side. And we actually strategically placed that sign in the gym right where when you come in and you exit. That way, it would kind of catch your attention because it is one of the brightest colored signs we have in our gym. And so that's what our goal was, is we wanted to actually, how can we just kind of get the conversation started about, because I will be honest with you, when I first got my license, the only thing they asked me is, do you want to be an organ donor, yes or no? And that's kind of the gist of it. That's all I knew about it. I didn't really have those conversations and things because it wasn't really talked about. So when we partnered together, and like I said, we put their logo on the back of our shirts, and that's over 1,000 kids come through our programs each year. And it's just not the eyes that's going to see that logo in our programs. Those kids wear those shirts out in the communities, and we have like a 20,000 population size in our county. And that's a lot of eyes that's going to be seeing that logo, and at least get those conversations started about how hey, well, what is Donate Life? Well, what's it about? And it kind of gets them maybe more thinking more versus just you want to be an organ donor or not. So that's where the partnership kind of really started. And then after that sponsorship, they actually branched out and helped with our summer food program, which you can see there. And then they actually came and did some summer activities with our summer fun camp kids, which was really cool. They did some activities in the classroom, did some health activities, physical activities outside in the gymnasium and things. So that was a very good experience, not only for us, but I hope they had fun in doing that as well. One of the main goals that we have is, we want to improve access to improve access to quality health services, strengthen our community, and strengthen our members and our people in our community. And that's one of the reasons I think we really kind of bonded over it, because I think that's a goal of both organizations. And one of the last things that they did with us was we always have a big health fair each year. We call it Healthy Kids Day. It's a nationwide initiative with the YMCA of USA, and they always participate in that. And of course, we draw a lot of people in with, we give prizes and giveaways and things like that. But it's a really good opportunity for organizations around our community, such as Donate Life, to come in and talk about their services, what they do, and just, like I said, just get those conversations started. And it's, like I said, it's been a very great experience for me. I hope they've got just as much out of it as we have, because it has really helped our programs, and I hope we've got the word out for them. And it's a very good visual aspect for both organizations. We want to, we have a local Donate Life office here in Pikeville, and we want to support our local groups, and we hope they support us as well. And it's just been a very good opportunity for us. And I hope they got as much out of it as we have. So I can't thank them enough for being supportive of our branch of the Pikeville area YMCA. And I'm just glad to be here to talk to you all about the opportunities that they gave us, and hope that we can get those conversations started and kind of get some more people involved with the organ donation.
Thank you so much, Clifton. We're so grateful to have organizations like yours outside of the donation community to be promoting organ donation and transplantation. So thank you so much. And we look forward to continuing to support your efforts.
Thank you.
Of course. Now I will invite Hillary Klein up to share how Donate Life America is improving donation awareness and increasing donor registration across the country. Hillary?
Thank you so much, Lauren. And thank you to all of the presenters here on the panel today, Molly and Dan. Thank you so much. It's important to start a webinar with tears, good tears. So that was beautiful. Thank you for sharing your story. Thank you to Morgan for all the incredible work you've done, not just at NKF, but throughout many years in the donation community. Just honored to be with you all here today. And thanks for making time during National Donate Life Month to join the webinar. I have a lot to share and 8 minutes to do it. And I promised Lauren I'm going to keep to time. So please drop any questions you have in the chat, and we'll try and address those as we go or in the Q&A section. Thank you. Next slide, please. So I wanted to talk to you today about outreach and action, our outreach during National Donate Life Month, and kind of what that action is, what our main call to action is at Donate Life America. For those of you who aren't as familiar with Donate Life America, I wanted to share a couple of facts for you. We were founded in 1992 by the donation and transplantation community. We're made up of national organizations and Donate Life state teams. Clifton, I love hearing that you're working with Donate Life Kentucky. You are in good hands with that incredible team. We direct national outreach and education to increase organ, eye, and tissue donation. We own and administer the national brand and symbol for the cause of donation, Donate Life. We're here in National Donate Life Month. We're so grateful to everyone for celebrating and really increasing awareness around the cause. We also own and operate the National Donate Life Registry for deceased donation registration, and the National Donate Life Living Donor Registry that's currently piloting in Texas. And we also believe in educating as creatively as possible or as necessary. And so we develop multimedia campaigns to educate about donation and promote donor registration. Next slide, please. Next slide. So National Donate Life Month, for folks who don't know, we've been celebrating for more than 20 years. We started it at Donate Life America in 2003. And it's incredible to see the wide celebration over the years. That screenshot there is of this year's White House proclamation on National Donate Life Month. And our goals are to help raise awareness about the importance of donation and to encourage Americans to register as organ, eye, and tissue donors, and also, of course, always honoring our donors and donor families. Next slide, please. These are just a couple of photos we get in every year for Blue and Green Day. We run a national photo contest. These are from last year. We're currently accepting photo submissions for the national photo contest this year. But these are some of our fantastic Donate Life state teams, individuals, and our clinical partners who sent in some incredible photos. Next slide, please. Some more fantastic photos, really raising awareness on Donate Life Blue and Green Day, which was last Friday. Next slide, please. So this year's National Donate Life Month, you'll notice we're all here in the night sky today because the theme this year is Donors are Superstars. This came from all of you in the professional community. We send out a survey each year after the end of National Donate Life Month and ask for feedback and ask for recommendations for themes for the coming year. And so many people really wanted stars incorporated into this year's theme. And it turns out that April is one of the best times of the year to stargaze. And this year we even had a solar eclipse, which was pretty tremendous. I know many organizations, I know LifeLink for one, had solar eclipse glasses made and events around that as well. So this April, we invited everyone to look up to the night sky and the billions of stars that make up the universe. Stars remind us that even in the darkest night, there is light. And that's why your decision to be an organ, eye, and tissue donor gives hope and light to the 100,000 people waiting on the National Transplant Waiting List. And that's why donors are superstars. Next slide, please. During April, we have a number of celebrations that make up National Donate Life Month. So Donate Life Living Donor Day, Blue and Green Spirit Week, Donate Life Blue and Green Day, and National Pediatric Transplant Week. Next slide, please. These are some of the photos we've seen so far that came in during Blue and Green Spirit Week. So you can see people baking incredible things, all of the flag raisings, and Donate Life rock painting by many of the ambassadors around the country. That's also a llama. Next slide, please. Donate Life Living Donor Day is one of our newest celebrations during Donate Life Month. It started in 2021. As always, the public is well ahead of us in what they are needing in terms of education and interest. And so we really wanted to have a day to celebrate and raise awareness about living donation, both for organ and tissue donation. So living kidney and liver donors, as well as birth tissue donation. And we see incredible public engagement on this day every year. So thank you to all of the incredible living donors. Next slide, please. Donate Life, a National Donate Life Blue and Green Day is an incredible day where we see so many of you be so creative in your blue and green and really celebrating the gift of life and honoring donors. As I mentioned, we do currently have a national photo contest happening where folks can submit your photos in celebration of Blue and Green Day. Next slide, please. National Pediatric Transplant Week happens towards the end of April. And this happens in partnership with UNOS, AST, ASTS, and transplant families. And huge recognition to transplant families who really were the catalyst that started this celebration several years ago to really bring attention to ending the National Transplant Pediatric Waiting List and also honoring our pediatric donors. Also, a shout out to the SRTR that creates this incredible infographic every year for National Pediatric Transplant Week. Next slide, please. So part of the way that we promote outreach and make outreach easier and possible for our professional community and for the public is to create all of these amazing things. So I'm sorry to bombard you with text on the screen, but we do all of these outreach pieces, these resources and materials, flyers, Zoom backgrounds, social, really are created in order to engage our public community, to celebrate and to raise awareness into their networks of trust, and also to aid our professional community in their outreach efforts during National Donate Life Month. Next slide, please. And this is what many of those resources look like, from social media graphics in English and Spanish to coloring sheets, infographics, and calendars for the month. Next slide, please. I think it's important to always measure outreach, and one of the ways that we can do that is sometimes through our social graphics. So we've had over 1 million impressions across DLA's social platforms just in this first part of April, and really sharing that importance of National Donate Life Month through inspiration, education, and activation. We had some incredible responses here to people sharing on Instagram that they're thankful for their living donor because all of these incredible reasons. Next slide, please. You can find these resources either if you're a member of the professional community on dlacommunity.net, And also a selection of these resources are available on donatelife.net on our public website. If you click on the menu under National Observances and Celebrations, it'll take you directly to everything you need. Next slide, please. So that's raising that outreach and that awareness. And then that call to action that we always at Donate Life America focus on is donor registration. Next slide, please. So for folks who aren't as familiar, the National Donate Life Registry launched in 2015. It's extremely mobile friendly. It's great if you have a national or a multi-state call to action. It has helped us have national projects with national partners like Walgreens and Apple that really need one specific place to send people to register when they have a broad push for this call to action and creating an opportunity for donor registration. We've also seen with the National Donate Life Registry, and for those of you who are participating in the donation initiative with HRSA, we create these customized campaign pages, both for individuals. If you're registered in the National Donate Life Registry, you can create your own individual campaign page to send to your family and friends or coworkers to encourage them to register to be an organ and tissue donor. Organizations can also customize these pages so they have brand continuity and can also really track how many people are registering with a live counter, which is pretty fantastic to see the difference you're making in sending out these campaign pages. We also allow for a choice of 3 key identifiers on the National Donate Life Registry, either last 4 of Social Security, driver license number, or a mobile phone with verification. The whole goal of this National Donate Life Registry was to make donor registration easy and secure, since most folks are on their phone more than their laptop and desktop, and wanting these aspects of it to be as simple as possible. Next slide, please. Some of the national partnerships that we've been able to work with the National Donate Life Registry include Walgreens, that have since registered more than 21,000 folks with donor registrations. Walgreens puts this donor registration opportunity in their Walgreens app several times a year. That drives to that campaign page. We also have an incredible partnership with Apple. You can register on your iPhone in your iPhone Health app since 2016. This is part of the operating system. It's not a downloadable app, so this will always remain on your iPhone moving forward. And that's where we see a huge flow of registrations coming into the National Donate Life Registry. Next slide, please. So far there's 11 million plus registrations in the National Donate Life Registry, more than 2,800 campaign pages. And that's through those, more than 83,000 registrations have come through. These are a couple of examples here from our great partners at UPMC and Northwell Health that have registered several thousand people through their hospital campaign pages. Next slide, please. I shared with you a couple of screenshots at registerme.org. That's the website for the National Donate Life Registry. And we made that donor registration form as simple and as clear as possible. Because when people are coming, we're doing that education, that outreach ahead of time. So when people are ready to register their decision to be an organ and tissue donor, it is an easy process for them to register there. And we see that reflected in our conversion rates on registerme.org. 13.2% might not sound like a big conversion rate, but the top 10% of websites across the country have an 11% conversion rate. So we feel pretty good about that conversion rate on registerme.org. And of note, registrations coming to RegisterMe from a referral site, so from a hospital or from another website, that increases to 26%. So I think it's those, again, networks of trust that really help in the registration process. Next slide, please. Moving forward, we want to continue our roadmap for registry optimization. About 20 years ago, we had a donor designation breakthrough collaborative in the professional community that focused on building effective state donor registries. And we are looking at these changes in technology and new opportunities for donor registration portals, data analysis, and the growth of the National Donate Life Registry, as well as opportunities to support registering your interest in living donations. So we're looking forward to the years ahead for some registry optimization. Next slide, please. That's it for me. Thank you very much. It's an honor to be here and look forward to any questions. turn it back to Lauren.
Thank you so much, Hillary, Morgan, Clifton, Dan, and Molly. If you all would join back on your cameras now, your videos, we will field questions from the audience. If anyone has questions, please enter them into the chat field now. I see that there is a comment in the chat about including the role of caregivers in organ donation and transplant conversations. Can anyone talk to more about recognizing and improving support services for caregivers in their current efforts or future planned efforts?
I thank you for raising this. We are working currently to add some resources and content around for caregivers on our public-facing website. So really appreciate you raising this. I think caregivers are an incredibly vital role within donation and transplantation. So thank you for raising that question or that comment.
Thank you, Hillary. I see another question, more of a general question. At the community level, who is responsible for providing the education about organ donation? Gabriella works for a community-based nonprofit that provides resources to the Hispanic community, and they participate in many health fairs and events. So they would love to partner up and are curious who's responsible for providing education about donation.
At the community level, is that the question there specifically?
Yes, at the
yeah,
community level.
absolutely. I'm going to drop a link in the chat about how you can get involved with your Donate Life State team.
Great,
And then
thank
you
you.
can connect with that for sure.
Yeah, thank you, Hillary. And I'll also drop some information in the chat as well about our donation campaign, which provides tons of resources that anyone is welcome to use to increase awareness in their community. If there are any other questions, please enter them into the chat. We will respond to you directly following this webinar. We are running short on time, so now I'm going to turn it over to Nancy Rios for closing remarks. Nancy?
Thank you, Lauren, and my remarks will be really brief as we conclude today's webinar, National Donate Life Month, Stars of Hope, Aligning for Life. We extend our heartfelt gratitude to all participants and attendees for joining us in this vital conversation on organ donation and transplantation. Throughout our session, we emphasized the significance of National Donate Life Month and highlighted the collaborative efforts between the Health Systems Bureau, the Office of Intergovernmental and External Affairs, my office, and our close partners. We witnessed inspiring stories from Dan and Molly, from individuals directly impacted by organ donation, underscoring the power of hope, resilience, and community support. Our expert panelists provided invaluable insights into the current challenges and opportunities in organ donation and health advocacy. Their expertise and dedication serve as guiding lights in our collective journey towards saving lives. So as we reflect on today's discussions, let us carry forward the key takeaways and remember that together we can make a difference. Together we can save lives. Let's also celebrate the positive announcements and achievements and extend our deepest appreciation once again to our panelists, our testimonial speakers, and to all of you participants for taking time out of your busy schedules to be here with us today. I encourage everyone to consider joining HRSA's Do Donation campaign to spread the word about organ donation and encourage donor registration in your workplace and in your communities as well. You can find all Do Donations key materials and enroll your workplace in the campaign at organdonor.gov or donaciondeorganos.gov. Looking ahead, we are extremely excited to announce our upcoming bilingual webinar in Spanish with live interpretation to English in August to observe National Minority Donor Awareness Month, furthering our commitment to inclusivity and accessibility in organ donation awareness. Before we part ways, we kindly remind all participants to complete our evaluation survey, as your feedback is instrumental in shaping future initiative. And as always, do not hesitate to reach out to us with questions about HRSA programs or requests for support and engagement. Once again, thank you all and have a great evening.